How do you think that online scheduling, that self-scheduling, do you see it, that aspect of it being able to help you in the future?
Just like the first presenter in the summit showed, telemedicine being a huge game changer. And there was a lot of hesitancy, risk averse, and regulatory and everything else that we had to face prior to COVID. Remote workforce is another great example. There were many things that were positive unintended consequences of COVID. And so patient scheduling, there's traditionally been a hesitancy to release the full schedule for patients to be able to schedule. We worry about inaccuracy of data that patients might enter themselves because insurance cards are very hard to read, things like that. So while there was hesitancy, I believe that many things have been proven in COVID that it actually does work, and we do need to move forward with it. So I believe for our organization, those are our initiatives that we will undertake.
Agree that historically, and that is one of the reasons why we couldn't actually move forward with our larger vendors, Cerner and Allscripts, because we hadn't previously configured for self-scheduling. But we do have a living proof of concept, and I think actually, Chris, you're amenable to trialing it to the behavioral health providers. What I think that would be a good step in showcasing that it can work when it's a behavioral health appointment. I think where the challenge historically has been with self-scheduling in particular is that 1-to-1 ratio. And so behavioral health visit is a set time. And so if we can get our foot in there and leverage our existing platform, Allscripts, I think that'll be a good segue to self-registering and scheduling. As far as the registration process, I think what we're finding, if we compare to our own errors that our registration staff do and patients create, so I'm Julie A. Jackson or I'm Julia Jackson, there's that matching queue. And so we'll always have that as long as we have humans, no matter whether it's the patient or us putting the data in, there's going to be that mismatch queue that we'll have to work. But I see great opportunity in Vail Health.
Too. I think it's really the future, and that is allowing patients, if they can, to direct not only their medical care, but also when they schedule and how they do it and at the convenience of their smartphone. One thing we've learned through all of this, it's, you hear about it, but you don't see it till it's really in an emergency. But everybody has a smartphone. Very few actually can log on to a computer or want to take the time to make a phone call and set something up with the scheduler. So allowing them to do it very quickly from their phone and get the appointment scheduled at their liking is a great customer experience benefit. And I think somewhere where we want to, as Julie and Susan have mentioned, want to go into the future.